Welcome back, viewer. This is Health Talk, and today we are talking about wounds. As you're here in studio, we have an amazing guest who is telling us about wounds, and we are learning a lot of new stuffs today. Dan.
Yes.
Welcome back.
Thank you.
We are talking about effects of wounds. We have seen the effects of wounds on the individual and also the family. There's so many families outside here suffering, or they're hurting because of their member having a wound. Now, the society at large, what impact or which impact has it had on the society at large? Wounds. From your experience working with patients with wounds, I know you have come across with maybe there are people who have retired, some are working, some are housewives, somebody busy somewhere building the nation, and they are having wounds. From your experience, what is the effect of wounds on the society or society at large now?
Thank you very much. To start with, wounds in the society, for example, the wounds are viewed in different ways. And those different ways mostly contribute to stigma. For example, the lady I'm telling you with a wound for over 28 years, you find that if you have, for example, a business, and we are Africans, for example, if you have a business and someone has been seeing you with your wound covered for a long time, people think that probably that is, you're doing something
like a witchcraft,
like some witchcraft or something. That is why you have that on your foot. Yet it is a wound that is chronic. It's genuinely refused to heal. But the society itself thinks, no, that is not normal.
That's black magic.
There is something you are using to do with that foot. Now, that is one thing. The other thing is, for example, what you were saying. You've been suffering from a cancer. Unfortunately, you have a wound that has been infected, and most cancer wounds tend to have a foul smell. You are supposed to, for example, go for a checkup or go for a change of dressing of your wound. You find that you get into a public vehicle and everyone gets out. Then the conductors, for example, say you either get out or you pay for for a full bus.
The whole full one.
Because no one wants to sit next to you. No one wants to sit inside the bus that is smelling. So you'll find that most people get stigmatized. The society itself is also causing more stigma to the people. And when that happens, you find that these people, at some point, they refuse to go for treatment. So in our setup right now, what we are trying to do is we are also encouraging something we call home care. It's a new concept. It has been practiced. It's normally done outside the country. Many developed countries have nurses and doctors, for example, going to visit patients at homes. So if you find that you have a problem that you cannot easily mingle with others, if you are able, try and contact someone who can come to your environment, because even your environment is very therapeutic for you. You find that when you are within your environment, you are comfortable and you don't care who else is there. But when you are going to other people's environments, sometimes even coming to a clinic, for example, and you find several people with wounds seated there, none of them has a smelling wound. And then you are the only one who comes, and then the environment changes. There's a lot of stigma even in that. When you find that someone is moving away because of a wound, and it's so unfortunate, you didn't bring that to yourself. So what we say is try and go to someone who is trained, specialized. There are even dressings that are used to help to prevent or contain that smell, and you can stay comfortably without that.
Wow.
Yes.
Thank you. I've learned a lot today. I didn't know there are some dressing which can absorb even the smell. I'm also learning something new, that is dressing, because most of people used to believe that if you have a wound, you must go to the hospital, maybe get admitted. I'm also learning that there is also home visits from you. Now, when you come to a conclusion of this talk
Yes.
about the cost of treatment, I don't know whether you should talk about the cost of treatment or let's see about how does it operate when it comes to managing of wounds at home. I'm trying to imagine, because you have talked about home visiting. I believe it cuts down the cost of admissions in the hospital.
Yes.
How does it work for somebody to enjoy that service of home care?
And now, for example, if let's say a patient is admitted in a hospital and probably you have a wound that is being looked at or taken care of, let's say once every 4 days. There are these 3 or 4 days that after that wound has been attended to, you have like 3 or 4 days that you're just staying in hospital. You're paying for hospital services that you can still get at home, even with a relative or a patient attendant. But in the hospital also, because they serve your food, you'll pay for that food. You won't even probably have a choice to choose what you want to eat. But compared to these being done at home, if the wound can be attended to at home, you'll be in the comfort of your house. You'll be taking care of the things that you've been taken care of every day. You'll be interacting with your family without restrictions, waiting for visiting time or something. You'll not be waiting for lunchtime to get food because you can ask for anything. You can even still be making decisions about the things that are around you because you are there with your family. Now, compared to being in hospital, hospitals are good, yes, but at some point, the environment that you are in at home is more therapeutic than the hospital environment. In a hospital, if you are, for example, in a wounds ward, for example, where everyone is suffering, a dressing is being done there and someone is screaming, it's not so comfortable, So the best thing is, if you are able, you can stay at home. In the end run, it is cheaper. Because, for example, if you were to be admitted in Aga Khan, for example, I'm not being discriminative, but let's just talk facts. If you are to be able to be admitted in Aga Khan, for example, what you'd be paying daily is not the same as what you'd incur if you are at home. If the dressing is being done once in 3 or 4 days, you can't stay in hospital waiting for 4 days to be attended to. You'd rather have that at home, use that money that you'll be paying every day to take care of yourself.
Wow.
And to take care of other things that are around you.
Wow. This talk is getting interesting each minute. I think you can talk about wounds almost the half of the day.
The entire day.
Yeah. I'm learning a lot of new stuff even today.
Yes.
Now, due to lack of time, I wish that we can also organize another program for we can just come and continue talking about wounds. How can our viewer find you? Do you have any social media handles or phone number or SMS line they can reach you so that they can benefit from that service of home care that you're talking about?
Okay, basically in my line of work, I restrict myself to my phone numbers. So if you want to reach me or if you wish to reach me, I'm available on phone numbers. My Safaricom number is 0711 846456. Alternatively, you can reach me on 0733 885 997. I work with several colleagues, and it's a good thing to do teamwork outside here. So if I'm not available, probably one of my colleagues will also be available, and I believe we don't disappoint in our work.
Wow, it's nice having you, Dan. Your parting shot to our viewer?
My parting shot is kindly, wounds are a burden, wounds are expensive to treat, but the earlier you start to treat them, the earlier you get you get well or you get healed completely. So the best thing to do is try as much as possible. People have social media interactions. People can Google. You'll always find a wound specialist. And once you get one, I believe you are likely to get the best quality of service. And as soon as possible, your wound may be done with. So my parting shot, wounds are real, wounds are a burden. Try as much as possible to get the best treatment for the wounds. Do not just go to a pharmacy to ask for something to do on your wound. If the pharmacist believes he knows what to do, then that is okay. But what I know is that wounds cannot be treated by someone who hasn't had an interest in wounds, who's someone who is not trained in wounds. So please, viewers, try as much as possible to get yourself to someone who is well trained and well versed with the variety of wounds, and you'll get the best quality of service. That's my parting shot.
Thank you so much, Dan.
Thank you.
There you go, viewer. As you have heard from our guest today, we have learned a lot about wounds. But due to lack of time, I wish that we'll have part 2 of this. And we'll also invite him again to come and talk to us about wounds. There's a lot we are still yet to tap from him. He has a vast experience in wound management. Somebody said, hospital ceilings are boring. And also somebody said, a healthy nation is a wealthy nation. Here at GBS TV, Health Talk Show, it is our pleasure and always our joy to make sure and bring you the best guests on show so that you can learn a lot and you can live a healthy life. Because a healthy nation is a wealthy nation. Remember to SMS us at 21144. Also GBS TV Africa. Till next time when we meet again, from us as Health Talk, it's bye for now. Thank you.